Is it really celiac disease or something else? The difference between 3 gluten-related disorders. Walk through just about any bakery or grocery store in town and you'll see the signs almost everywhere along the shelves. Gluten-free cookies, gluten-free meatballs, gluten-free pasta, gluten-free lipstick. Going gluten-free seems to be a popular lifestyle choice these days. One survey revealed that 3.7% of the UK population is on a gluten-free diet, while another survey found that almost 1/3 of adult Americans would prefer to reduce or avoid gluten consumption altogether. But a gluten-free lifestyle isn't always just a dietary choice. For some, it's a medical necessity. There are actually a number of gluten-related disorders directing people to make the switch to gluten-free living. Celiac disease occurs in about 1% of the population, with the number of people affected doubling every 15 years. To better understand if someone may be struggling from celiac disease or another gluten-related disorder, it's helpful to first understand what gluten really is. Gluten is a group of proteins that act as a binder, similar to glue, holding different foods together. It's found in grains such as wheat, barley, rye, and a cross between wheat and rye called triticale. Now, when someone eats one of these items containing gluten and has a reaction of sorts, they may suspect it's a gluten-related disorder. And there are 3 main categories for these disorders: celiac disease, non-celiac gluten sensitivity, NCGS, and wheat allergy. Because gastrointestinal symptoms of all 3 gluten-related disorders can seem similar, it can make them difficult to diagnose. However, the 3 are very distinct. Let's first take a look at wheat allergies. People with a wheat allergy have an allergic response to eating wheat, so they might get a stomachache after eating a bowl of cereal because their immune system identifies wheat proteins as harmful. That means their immune system responds and releases histamine and other chemicals, which then may cause allergic symptoms such as hives, nausea, or stomach cramps. People with celiac disease have an autoimmune response to eating gluten. So when they eat gluten, the body responds by attacking the small intestine. These attacks lead to damage on the villi, small finger-like projections that line the small intestine that promote nutrient absorption. When the villi get damaged, nutrients cannot be absorbed properly into the body. While some people may be affected by the more common symptoms of celiac disease, such as diarrhea, weight loss, and bloating, others may exhibit non-digestive symptoms or no symptoms at all. Over time, untreated celiac disease can lead to malnutrition, intestinal damage, and other serious health complications. And lastly, there's non-celiac gluten sensitivity. NCGS is often defined by what it's not. It's not an allergic reaction like a wheat allergy, and it's not an autoimmune reaction like celiac disease either. NCGS occurs when a person experiences symptoms similar to celiac disease, but doesn't actually have celiac disease. The symptoms include diarrhea, abdominal pain, and bloating. But people with NCGS also tend to have non-digestive symptoms too, such as headache, mental confusion, a foggy mind, and fatigue. These symptoms usually disappear once gluten has been removed from the diet. You can see that while symptoms of these gluten-related disorders are similar, wheat allergy, celiac disease, and NCGS are all unique from one another in terms of exactly why a person may react and how the body responds. And living with these symptoms, while it may mean giving up a favorite sandwich, can have more serious, long-term impacts, aside from being downright uncomfortable and perhaps a little embarrassing at times too. There's a reason there are so many gluten-free options available today. Gluten-free foods, while they appear to be everywhere, can play a huge role in a person's quality of life, because even scant amounts can cause a reaction. For example, over-the-counter medications can be processed in facilities that also produce gluten-containing products, therefore having a minute amount of gluten. But before trying to manage symptoms or drastically changing diets, it's important to know for sure if the symptoms a person is experiencing may be related to celiac disease or something else. The first step is to get tested. A blood test under regular gluten exposure, together with your medical history, can help the physician differentiate between allergy, celiac disease, and other conditions. Talk to your healthcare provider about the different testing options available. To learn more about celiac disease and gluten-related disorders, Visit allergyinsider.com.